Thank you, Christian, so much for introducing the talk already. So really, it's about transition to adult services. It's not the most exciting hot topic, but it is quite useful for parents in having all the right information that you will need to think about the key elements of transition, and just learning about some of the technical words and language that's out there in the NHS that can be quite sort of tricky to navigate. So I'm hoping today I can just give you an overview of the services that are out there and help you think about what could make that process easier for you and your child. So I'm going to start by just talking about the transition process. If it'll let me move on from my slide, it's not going as smoothly as I'd like. Here we go. Is everyone able to see that second slide?
Yeah, brilliant. We can see it.
Great. So the transition process begins from about 17 years and 5-6 months. And this is a process that begins in CAMHS, which is your local child and adolescent mental health service. But this process can also vary across the different regions of the UK. So a lot of what I'm covering today, I'll be sharing sort of overall views or kind of the ways that services might be set up in general, but it's important that I say that there are local variations in how services work. So the process may not be exactly the same where you are, but it's still very helpful for you to know how services are set up across the UK and how they commonly work. So you'd expect that transition process to be starting then, because especially with young people who may have, severe enduring difficulties that need ongoing input, it's really important that transition process starts as early as possible, which would be 17.5 years. So that relevant services can be identified, and so that the young person and parents can be prepared in thinking about how they get referred onto their services, things that they may need to do, and information that they would need. How the services work is that you can self-refer to some of these services, and I'll share a bit more about which services that's relevant to, and others require a GP or mental health worker referral. And the type of services that will be identified as relevant to your child would probably depend on the severity of their difficulties and the ongoing input that they're going to need to maintain or their recovery or remain well, or for a further piece of work. Usually in services like these, you find that referrals are made to an adult service, but they go to a single point of access or a common point of entry. And at that stage, the severity, the presenting problem, all these different aspects of the difficulties are looked at, and it's thought about which service it's best placed to support them. And after that common point of entry or single point of access, then the referral is passed on to the relevant service. Some services, it's important to be aware, is that if your child has had intervention in the past 12 months of having specifically CBT for OCD or BDD, it may mean that they are not eligible for another course of treatment straight away, and they might not be offered straight away. But having said that, that isn't a standard sort of rule or case across services, so that may not be relevant to some services. So then thinking about the services and how they're set up, I wanted to first start by sharing how generic adult mental health services work. So it's really important that you know how these are set up so that you can think about how specialist services work. And the reason for that is that there's kind of different steps towards receiving support from specialist services. You start off, as you do with most things, is with your GP, and then you go through the process of primary mental health services, if that's relevant. Then there's secondary mental health services, and then you might go into more specialist services. So there's a sort of tiered system that is in effect in the NHS, and that's how you can access support. So with the generic adult health services, I should say, there's also the voluntary sector to take into mind. So I'll explain a bit about that as well. So here are focused on the primary and secondary care support services that are out there. So one of the main services that are available to adults with a range of mental health difficulties is IAP services, and that is short for improving access to psychological therapies. Why that's considered primary care is because it's linked. It can be something that you self-refer onto. So it's kind of your first point of contact, really. So the same way we'd consider GP to be primary care, you can access them as and when you need them. It's the same with IAP services. Now, what's tricky about IAPT and can be quite difficult is that although they're an IAPT service, they may have different names, different titles. And even if we're thinking about just London, IAPT services dotted around London, and there'll be lots and lots, may have different, slightly various different name, things like talking therapies, time to talk, talking space. So it's just to be mindful that even though the title may not be IAPT, that service may be under the umbrella of IAPT. So these are services where you can generally self-refer either through just completing an online form, getting in touch with them, and they typically call you within a few weeks to do an online phone assessment, and to think about what kind of support you might need. Therapy doesn't include multidisciplinary approach. So these services are primarily therapists and clinical psychologists working to offer a range of different therapies. They offer CBT and other evidence-based therapies as well, but they don't include other multidisciplinary team members like psychiatrists, like occupational therapists, similar, who may offer that more sort of multidisciplinary approach. They also have a stepped care approach program. So what that means is that even within their service, they'll be thinking about what are the kind of initial steps that may be helpful. And often they'd recommend for a lot of the clients that they see, that they start off with guided self-help and move on to more kind of more intensive support. So guided self-help is just that you've got access to resources and materials that explain, for example, how CBT works and the kind of things that you can try out, and then you go off and try out those things with occasional maybe check-ins with the therapist, but nothing like a structured one-to-one approach like you'd have in CBT, for example. But if the severity of the problem is not going to suffice with guided self-help, then of course there are therapists within the services that offer more of that one-to-one intervention. IAP services also do groups and lots of other interventions that are tailored to a range of different disorders, including OCD and BDD. And they might also be offering specific support for their local communities as well. So the IAP services can kind of vary in that sense too. And then the secondary care is what you'd be thinking about, where your GP really needs to refer you on to. So that would be the equivalent of if you went to your GP and you needed, you had an ear infection that wasn't being treated and resolved, they refer you on to ear, nose and throat specialist. So you're moving that step up, and that's what the secondary care is about. They're more kind of able to offer that higher level of care, and you usually need a GP or mental health worker referral to those services. And they can be split up in different ways. So they're not always called community mental health teams. They may be called brief assessment and treatment teams. They may be called recovery teams. They can have various names. And sometimes they're separated into brief treatment and more kind of longer term support for enduring and difficult mental health difficulties. Now, these secondary care services are multidisciplinary teams, so they tend to have psychiatrists, they may have nurses, they often have nurses, they may also have occupational therapists, employment support. There'll be a range of different professionals within these services. And what that means is that they can offer medication reviews. So in terms of thinking of the evidence-based treatment for OCD and BDD, they can kind of be looking both at the therapy, but also medication-wise, what support might be needed. In a community mental health team, what you'll typically be allocated is a care coordinator. And that's not so different from CAMHS, where you have a care coordinator as well. And that's your person of contact, someone you go to oversees your overall care. And that's particularly helpful in a multidisciplinary team, because that care coordinator can help you identify what other bits of support you might need. They can also help complete care plans and arrange care plan approach meetings, or what we sometimes call CPA meetings, where professionals will get together from a range of different backgrounds and think about all the different areas of need. Another aspect of generic adult mental health services is the voluntary sector, because sometimes for some services, voluntary services are funded by CCG or in other ways to offer therapeutic work. This could be organizations such as Mind. It can also be a range of different organizations, and they tend to offer mostly therapy. And they don't have specialist knowledge or work in particular areas. They may do kind of generic counseling, therapy, that's informed by particular therapeutic models. So that can also be an option for a generic adult service if things may be on the milder side, or if the difficulties seem to fit well with what these voluntary services can offer. So that's just really giving you an overview of what generic adult mental health services look like. And to access any of the specialist services, you do need to be known to your generic adult mental health team, in the same way that if you wanted to access our service as a specialist service, you need to be known to your local child and adolescent mental health team. So just to describe a bit about these services, so I've split the specialist services into community and inpatient. So there's services, and to make you aware that these services are there and available to everyone across the country. So the first one I'll start by talking about is the Centre of Anxiety Disorders and Trauma, which is a service for adults with a range of anxiety disorders and trauma, as it says in that title. And Dr. Blake Stobie was here in the conference earlier talking about what is from the service, I should say. And this is a service for adults, so it would be 18 and above. And it is a service that can include that provides specialist CBT input for a range of different disorders. And that includes OCD and BDD. They can also offer specialist advice if you're under a particular funding pathway, and I'll come to that in a bit. And the way it's set up, I'm just going to have my notes here so I make sure I'm giving you all the accurate information, is that it's sort of slightly tricky with some of these specialist community services, because they can have referrals through various different means. So I did say earlier that you need to be known to your adult mental health team, but there can be instances where you don't need to be known to your local adult mental health team, and where your GP can refer you in to some of these services. I think that's most relevant to the Centre of Anxiety Disorders and Trauma, where certain GPs outside of their catchment area can refer patients through patient choice. If you're in a local area across the country, you're not sure whether that's relevant to you, please get in touch with them. I've got their link here in these slides. You can also Google it, their name, and also contact them directly to see if that is possible for your child. So what they offer is, like I said, CBT and sometimes intensive treatment as well, where that's relevant. They are able to offer up to 12 to 20 weeks of therapy, and that's usually done on a weekly basis. Their inclusion criteria is really that, anxiety disorders, trauma, that those sorts of difficulties are your main presenting problem, and that you're willing and able to engage in treatment. And exclusion-wise, it's whether there's no other presenting problems, such as depression, which is that needs to be treated initially, and that there's not excessive kind of previous history of risk or support, or the intervention doesn't require inpatient care. So this is, and I should have mentioned, with the community services, it's all services that are being offered on an outpatient basis in the community. So it doesn't include that kind of inpatient level support. So that's Centre of Anxiety Disorders and Trauma. And then we've got Oxford Health Specialist Psychological Intervention Centre, or OSPIC, that's opened recently, and is offering interventions to anyone aged 5 and above. And that is including one-to-one CBT in line with NICE guidelines, and they work very closely with the local team. So they are a service where your child will need to be known to a local team to receive input from. And they have a wide catchment area. They can travel outside of Oxford to kind of reach out to the, if at-home treatment is required. I'm not sure exactly about their remit, but that is an option. And they treat, like in the way that we'd expect, OCD, BDD, but also other anxiety disorders as well. The Hertfordshire Partnership University NHS Foundation Trust, the OCD BDD specialist service there, is a service that offers both outpatient and inpatient support, and their focus is also very specifically on CBT with ERP. And they do also use other approaches to help utilize an enhanced treatment response in young people or adults who would need it, and offer some somatic treatments as well. And they're based in Hertfordshire, as is suggested by their name. So this is just an example of a few of the different specialist community adult services out there that can be accessed if specialist treatment is needed. Oh, sorry, I've skipped over that slide. And then the next bit is to be aware of is, the inpatient services out there as well. Ideally, we want to do everything that we possibly can in the community to support young people and adults before we consider admission. But sadly, it is one of those things that we do need to consider at times. And when it is considered, can be incredibly beneficial for the person. So there's a few options in that. I've already mentioned the Hertfordshire service, but there is the Anxiety Disorders Residential Unit, which is at the Bethlem Royal Hospital in London. And they offer and treat a range of different anxiety disorders and do that through intensive treatment, as you would expect in an inpatient service. There's also the National OCD BDD service at Springfield Hospital, which offers specialist intervention as well. And then there's the OCD BDD service at the Priory, North London as well. So what these services have in common really is that they're able to offer a multidisciplinary approach. So that includes psychiatrists, psychologists, therapists, nurses, occupational therapists. They can offer individualized treatment programs to really help with the progression of where there's been, stuckness, treatment resistant OCD or BDD, and when things have really been trialed in the community and that's really not moved things forward. For these services, you usually would need a referral from a consultant psychiatrist or from a secondary or specialist mental health service, detailing what the goals and aims of the inpatient admission would be. And the important thing to mention about these specialist inpatient adult services are that these are planned admissions, so they're not sort of emergency risk admissions. They would be sort of planned to do that more specialist intervention work for OCD or BDD, and they really allow for that intensity of input, and that can sometimes be really needed for some young people and adults as well. And so thinking about the referral pathway to these specialist community services, or even the inpatient services, is that, well, I'll start with the community first, that you do need a GP or community mental health team referral. There's two areas of funding to be familiar with here, is that when we're looking at specialist OCD and BDD services, they can either be sort of CCG funded, and you've got that term defined here at the bottom, clinical commissioning group funded, and that's by your sort of local care clinical commissioning group, or it could be a NHS England highly specialist service funded, and that's two different funding pathways. And how they vary is that the CCG funding will be quite specific piece of intervention that is funded, and that specific piece of work, whereas the NHS England funding, the HSS funding, is a lifelong pathway that's not limited to any one particular treatment episode. And once a referral is made by the GP, the mental health, or the community, the CMHT, the decision's then taken by that specialist service to think about, is this a CCG funded referral or is this HSS? And how they make that decision really is they think about what previous things have been tried. So to really have the NHS England funding, there need to be several things that have been tried. So that means 2 trials of CBT, as you can see here, tried locally before referral, 2 different types of SSRI medication, and then an augmentation even with an antipsychotic medication as well. So there's quite a few steps that need to be taken to have that HSS funding. Otherwise, you'd fall under the CCG funded category. And so to receive the specialist community adult services, you do need to have funding in place. So will be a process of applying for funding and potential delay if the funding's not already in place. That's important to just kind of expect that if that's possibly happening. So what are the similarities and differences between child and adult services? There certainly are differences in the sense of how services might be set up and the expectations that they may have of the child, the young person, the adult, I should say. Well, some of this, but there are also similarities. So the similarities are that there probably be offered CBT, would be either 1 hour weekly or fortnightly, and usually based within the clinic. The difference is that sometimes CAMHS services can be more flexible and offer more home-based sessions, whereas adult services may not be set up in a way to do that. The similarities are also medication reviews if we're looking at adult mental health teams and specialist teams, and the difference is that some medications may not be approved or licensed for children, so they might not be tried out. Some of the similarities between the two are having one-to-one therapy that would be offered. The difference with CAMHS is that although we're thinking about one-to-one therapy, CAMHS clinicians think of the wider system a lot more. They might be therefore systematically orientated. They'd be thinking about how to involve parents, how to work alongside parents to help make that change. So there's more of the working with the system within a CAMHS setting. Another similarity might be the number of sessions, so 10 to 12 weekly sessions. And there might be a more sort of linking in with parents between the sessions in CAMHS services than in adult services, where the young person is expected to take a lot of the ownership of their treatment and expected to be motivated and engaged with that process. Similarity, again, we've got CBT might be a similarity. Child services can sometimes take other approaches. They might have sort of the family therapy hats on. They might consider more behavioral approaches as well. So they can sort of combine those different approaches as well into their work. And then we've got CPAs to coordinate care, which happens across both CAMHS and adult mental health services. But what might be different in CAMHS is that the therapist working with the young person might be doing more kind of liaison work with school. Again, just having more sort of involvement with the system. And like I said, in both services, you do need active engagement, to make the most of treatment. But CAMHS services may be set up more to kind of support that engagement with the work and do that, be more accommodating of those challenges, perhaps, than an adult services, maybe. So that's just a bit about the similarities and differences. I'm sure I haven't covered all of them there, but it just gives you an overview of what may be similar, what may be different. And then top tips, because, it really is a time of transition. It is, you have young people transitioning to adult services, but they don't, suddenly turn 18 and become fully fledged adults with the ability to make really complex decisions about their care and being able to engage. There's not a kind of switch that goes off at 18. So it's really important to bear that in mind, and that's something that should be mentioned at those transitions meetings as well, that this young person is transitioning into adulthood. That's the main thing that's happening there, and that takes time and will need scaffolding and will need support. What can be done to support that transition is just managing the expectations, and that can be your expectations as parents, that can be the expectation of the young person, and it starts by just giving them maybe encouraging a bit more autonomy and decision making on their part, so that they're not sort of thrust into this adult mental health setting where they're expected to make lots of decisions and the contact's made directly with them, and they're not feeling up to making any of those decisions. So it could be a nice way when you're starting to think about transitions to think, okay, what are the areas that I can support my child in making some of those changes, decisions, and how can they communicate that, or how can I encourage them to do that in a way that feels manageable and a good starting point? Another way to prepare for that transition and autonomy is to start meeting with the CAMHS care coordinator less frequently. So just kind of setting it up for change in how often the contact might be with the care coordinator in adult mental health services. So it's not a big change from sort of weekly, really intensive input to nothing at all. It's quite helpful that things are done sort of maybe gradually reduced, so that change, it doesn't feel too overwhelming. Communication is absolutely key. Do not be afraid to ask questions. It's a transition for your child, but it's a transition for you. And it is a time where you will have lots and lots of questions. And sometimes when we go through these transitions, we just kind of get swept on the journey. It feels difficult to ask some of those questions, but do take time to check in with yourself and think about what questions are coming up for you or where things aren't feeling very clear. So one of the areas that to think about communication and to facilitate that communication is to make sure that your child and you've given consent for the services to communicate with one another so that they can already start that transition process, and that meetings have been arranged before the 18th birthday to really facilitate that and give space for asking any more questions. So the more you kind of have that transition meeting earlier on before 18, you've got an opportunity to ask some of those follow-up questions later on before your child's discharged. Now, parents can be involved in care in adult mental health services, but the young person must consent to this. And you might find that adult services are approaching the child more frequently, calling them, trying to get in touch with them rather than contacting you, which will feel like a change. But what you can do to facilitate that is just help the adult service understand what your child's able to do, what they might find tricky, and that they've consented to them contacting you in certain circumstances or in all circumstances, whatever might be the best thing for you and your family. It's also quite important to clarify that transition plan before discharge from CAMHS so that you're not sort of left in a place where you are really unsure about what the plan is. So it's just identifying what services have been identified, what are they going to offer, under what circumstances are they going to offer that support, and could that possibly change? Who's going to be your point of contact at the adult mental health team, and what do you need to know in terms of what would be the sort of biggest changes really from what CAMHS has been offering so far. So that's really important things to just sort of check out. And then also do ask what to do if you're not happy with the plan. You may not be happy with the plan that's being proposed. You may not feel it's meeting the needs of your child. You may feel that you haven't got enough information. If you haven't, please communicate that with them and ask what you can do if you're not happy with the plan that's being executed. How do you take that forward? And of course, just keep in mind the support networks out there and connect with others who've been through that, because it is really tricky process, like I said, and you cannot have too much support. So please reach out to charities. We've got OCD Action here is doing fantastic work, but other charities as well, where you can connect with people and feel supported.